Hi everyone, my name is Violet Wango and I'll be taking you through this month's webinar. So we'll be looking at writing an excellent reflective elective report. So to get started, if you're not able to connect, there's a chat platform. You can send your text message and we'll be able to get back to you on how you can connect with us. So getting started, that is just an outline on what we're going to be looking at. So we'll give a definition of a reflective elective report. We'll also look at the importance of writing a reflective report. We also take you through some of the important questions that you need to ask yourself when analyzing your experience to ensure that you come up with a good report. We also look at some of the considerations to look at when writing a reflective report. I will also give you some few tips on how to write a great report, and also some of the useful phrases that you can take advantage of. And finally, my colleague Justina will be taking you through how this works with Elective Africa. That being said, we'll get started. And some of the things that we hope that you're going to get from this webinar is you'll be able to plan for your report. You'll also be able to identify the effective ways of writing this report. And also you'll be able to put into writing some of these things that we will be sharing with you. So welcome to our webinar and have a lovely time, and feel free to ask questions in between the session. So we'll start by defining a reflective report. I don't know how many of you guys have been involved in a fight, either physical or verbal. It's not a great experience. I've started one or have experienced one, and I'm also sure it hasn't been good on your side. And the reason being that later when you sit down and when you cool down and you try to make sense of why you are arguing even in the first place, you feel even disappointed in yourself. So you'll start asking your question, why you even said some words in the first place, why you didn't walk away. But it has already happened. And so for future purposes, you promise yourself that you will handle the situation in a different way. So that in itself is reflection in its simplest form. That is reflection. So what's a reflective elective report? Having this in mind, or the description that I've just given. So it's just the process of unbundling the experiences you had, and in terms of the skills gained in the process of a rotation. You realize that most medical students, or what you've realized as Elective Africa, is that most medical students opt to travel abroad for an elective, and this normally doesn't end. This elective doesn't normally end after you've traveled. It goes way after that. You'll be needed to do a report of the placement, especially if you're doing this for credit purposes. So the elective experience that you're going to get, it gives you a better opportunity for writing a reflective report, since most electives will involve some personal and life-changing experiences. So when doing an elective reflective report, you may choose to reflect on the overall experience, or choose a number of examples of incidences that were important to you. So in this reflective report, you'll have the description bit, which contains the facts making up the experience, and the reflection. And the reflection, you'll be evaluating the experience. That being said, we'll now look at the importance of writing a reflective report. So one thing that we need to note is that doing a reflective report is not about generating a lengthy description of something that has happened to you, or something that you've seen, but it's rather an analysis of what has happened. Having that in mind, we'll quickly run through the importance of writing an elective report, and how this will help you in your future practice. So number one, Number one is that it helps you integrate the theoretical learning and the clinical practice. So in your elective, you're likely to witness or directly participate in a variety of important events like performing of a C-section, insertion of a catheter, and many more. So a reflective report will allow you to report on these experiences in a way that progresses you as a professional. Apart from this, sometimes things may not go on as you see in movies or series. If you ask me, it's messier than what you think in these movies. For example, The House. So if you are taking an elective in Africa, for instance, you are not only likely to encounter inadequate human resource, but also facilities. So medics are therefore forced to be innovative to deliver healthcare services, despite the several challenges in their system. How they do this is something worth noting and something that will come in handy even in your future practice. So in the process of learning, you'll also be able to witness and participate in a number of important events in relation to your life and the life of others around you. So it's important to analyze these events and report on them in a way that will improve you as a professional and also will reflect, you should reflect this on this report. Finally, on the importance, it's also a reference point and an evidence in the future. You'll be able to go back to this report and see how you are able to handle some situations or how you're able to react to certain circumstances. So hopefully, when you'll be doing your report, you'll have this in mind. So you realize that when you're doing this reflective report, we are able to learn, we're able to develop our skills, and you're also able, these events are also able to inform us in our practice in the field. So having said that, we want to look at some of the questions that you need to ask yourself in to be able to come up with this report. These questions are just to help you in analyzing your experience. So we'll look at them and you'll be able to see how you can use some of these questions to write down your points and also come up with a great report. So one of the questions that you need to ask yourself is, what was the impact of the experience on you and other members of the team you worked with? Considering you'll be working with a team of expertise or healthcare professionals, you need to be keen on some of the events that you'll face, or some of the procedures that you'll be undertaking in a team. So these will be important for you because you'll be able to write down some of the things that you experienced and how it impacted on either you or the members of your team. You also need to think of how what you did fit in your previous teaching. If it's something a procedure that you conducted, how does it fit within your previous teaching? Considering that before you come for an elective, if you're a medical student, you need to have gone or have registered in a medical school, that is for Elective Africa. There are things that you're taught before you can go for your clinical rotations. So in this experience, in your hospital experience, you're able to see how the practical is going line in line with what you're taught in class. So after looking at how this fits with your previous teaching, you should also look at what went wrong with your placement, that is, if there is any, and how you are able to learn from it. And from these lessons that you learn from maybe what went on wrong or what went on well, you'll be able to take some key learnings or key areas from these experiences. And this will help you reflect on your own attitudes and even behaviors. So if you're given a chance, do you think you'll change how you did a particular procedure or how you reacted to a particular situation. So this question will also help you know how to put this in writing and how you can be able to give a good feedback or do something about your particular situation in that particular moment. So going forward, we are going to look at some of the considerations in writing a reflective elective report. So number one is returning to experience. So this basically it's just a recollection of the salient events. So in this area, you're supposed to consider starting with a description of what you or other people, that is your colleagues, patient or visitor did, and maybe what you observed, and you can also outline some of the key aspects in that particular situations. The second thing that you need to consider is attending to your feelings. So this is a conscious recollection of the good experiences and also the bad experiences, the attention to the pleasant aspects of the immediate environment, and also the anticipation of the possible benefits to be derived from the process of the event. So you should consider your reactions. What were your feelings at that particular time? What are the feelings now? And any differences, that is, if there's any. And also, you should also look at some of the effects on what you did or did not do. Because you'll find out that sometimes you're faced with a particular situation, and since you don't have that particular expertise, then you have to wait or you have to leave the doctors in that particular location that you will be undertaking your elective to do it. Sometimes you're forced to observe since you still don't have the practical skills to do a particular procedure. So these are some of the things that you need to look at. The third thing you need to consider is re-evaluating these experiences. So you're trying to associate the new knowledge with what you already had. So you should consider asking yourself the following questions. Number one, what are the implications for you, your colleagues, or the patients? And maybe what you think should have happened so as to alter the situation. And what are you going to do about what you experienced, and maybe what you might have done differently or what you might do differently if you're faced with a similar situation. And if there is any gap that you experience in your knowledge, then you should find out on a way in which you can fill on these gaps. So we are almost done with the presentation, but before then, I want us to look at or to give you the 4 tips that you can use to ensure that you get a great report. So number one, it's normally advisable to enter your diary or your daily log on a daily basis. So what you can do is you can write an activity that you experienced during the day or you undertook during the day, and then reflect on it, and you can write a comment a few days later. Justina will be talking to you later how Elective Africa ensures that you fill in these daily logs to ensure that you get a good placement. You also need to explain your feelings in relation to your strengths, capacities, fears, weaknesses, and also biases. The third point is you need to suggest alternative actions that you might have taken or might take next time. It's important because undertaking an elective, it's not just about what you'll experience there and then, but it's also about learning from certain experiences or certain events, and also coming up with actions on how you can be able to do this, considering you're going to be a doctor for life or a physician for life. So it's something that you need to consider because your practicing doesn't stop during your elective, but it's rather a lifelong profession that you'll be doing every now and then. So give advice to yourself about what to do in the future. So you can also find questions which you need to think about, or issues which you do not yet understand but need to understand. I think that is one of the main reasons why students undertake an elective abroad, because getting to experience a different healthcare system that is different from yours is something that is really enriching. You also able, because you're, for instance, if you are undertaking an elective in Africa, you'll find that healthcare practitioners are able to manage with limited resource and also be able to treat certain diseases. So you're also supposed to ask yourself these questions on, if, for instance, you decide to later do your practice in a developing country, how will you be able to handle certain situations, and are there way forwards on how you can be able to handle it? So the following are some of the useful phrases that you can use in the report. So these are just in addition to the tips that we've given you. So you can start by talking about maybe writing, this experience was important because of ABC or XYZ. So you're the one to decide, and maybe the impact of this patient on the impact of this on the patient appeared to be, you name it. And these questions or these statements phrases will help you get started on writing your report. So how does this work with Elective Africa? So Elective Africa, being an organizer of healthcare placements abroad, and having done this for over the last 17 years, Elective Africa is keen on ensuring that steps are put in place to ensure that you have a great reflective process to write your report. So one of the things that Elective Africa has put in place is you need to write down your statement of objectives even before you come for placement. So these will just to help the organizer know what you really want to do, and also to monitor what you'll be doing in the hospital and if these objectives are met. Because it's from these objectives that you'll also be able to write some of the experiences you benefited from your placement. So while on ground, you'll also be required to fill in your daily activity journal, which will help you detail your day-to-day experiences at the hospital. And something else, it's not only at the hospital, but you'll also be able to go to different places to volunteer. For example, if you're to be placed in Mombasa, Kenya, you'll go to Pentros Community School, and you'll be able to volunteer your skills, maybe teach them science or English, and also have a little talk with the kids there. You can also decide to go and help at orphanage in Mombasa and also in Tanzania. So these are some of the activities that you need to add in your daily journal. I believe it goes a long way in ensuring that you write a good report. So in conclusion to this, we also require all our participants to have a session of evaluation for the program. So this session will help them to reflect on some of the items that best shaped their experience abroad. So having said this, you are the one to decide if you're undertaking an elective abroad. Don't be hesitant to call us, and we'll be able to provide you with the best experiences. So I'm going to invite my colleague Justina to take you through some of the hospital internship opportunities that Elective Africa has to offer.
So thank you, Violet, for taking us through that session on how to write an excellent reflective report. I'm sure as at this point, you are asking yourself, what kind of electives or what are the electives which you can undertake in Elective Africa? So some of the healthcare, or rather the healthcare electives available with us are medical electives, where you're able to shadow doctors. To take part in hands-on experience and supervision and mentorship with the doctors. Also, we have the physician assistant electives, nursing electives, midwifery electives, dentistry electives, and also internships in public health and research. For those who have not yet joined healthcare school or are seeking to join healthcare school, we also have provisions for shadowing internships here with us. And some of the provisions that we have is the pre-med shadowing internships, pre-physician assistant shadowing internships, pre-nursing, pre-dental, and pre-midwifery. So the programs which are listed over there, in case you want to undertake any, you just contact us and we will be able to offer you a tailor-made and customized placement which suits your requirements. So further to proceed, you can get in touch with us, send us an email at the email provided over there. You can give us a call or even find us on social media on Facebook, on Twitter, or Instagram. And one of our placement advisors will be happy to get back to you and, of course, guide you through the next steps in planning and securing your internship or rather elective here with us. So thanks a lot for listening to me. I invite Violet to take us through the Q&A session.
So just before the Q&A sessions, still a reminder, if you have any questions, kindly feel free to write them on the chat. So before we go, these are the following things. The following things are things that you need to consider. You should be clear about your aims and objectives. So you should be able to describe how these were met in your report. You should also share a brief on what is already known in the subject or field. And you should also give a reflective analysis of your experience, write a conclusion, and share your recommendations about the program. And there you have it, your reflective elective report is ready. So having said that, if you have any questions, kindly feel free to send us a chat, and with the contacts that Justina has just shared, you can reach us via email, you can call us, you can reach us on Facebook, Twitter, or Instagram. So bye, that's all for today, and I'm hoping to see you next month in our next webinar.